Would you like to learn from those that are taking their lives, their businesses, and their passions to the next level? Best-selling author of Speakeasy and master connector Lou Diamond is here to connect you to some of the most inspiring and amazing people on this planet. Get ready to thrive loud with Lou Diamond.
Welcome, everyone, to another absolutely fantastic episode of Thrive Loud with Lou Diamond, connecting you to the most inspiring and amazing people that are thriving each and every day. I'm your host, Lou Diamond, and today I remind you, my fellow listeners and viewers out there, that medical misinformation is everywhere. And finding a place you can trust online has been challenging, to say the least, for many, many years. Because everyone really just wants to feel better, and they're just providing so much information out there, you don't know who to trust. And so I'm excited to bring you today's guest. She's a double board certified orthopedic surgeon, TikTok influencer, best-selling author, and the founder and CEO of the new FeelBetr app, a health-focused social media platform designed for people navigating chronic and complex health conditions. Thrive Loud listeners, I am so excited to connect you to Dr. Erin Nance on this show today. Dr. Nance, welcome to Thrive Loud.
Oh, thank you, Lou. It's my absolute pleasure to be here and with your listeners as well.
I'm a little bummed, listeners, because we had a chance for the two of us to be in the same place, but we just couldn't make the universe work together not too long ago. But I got her virtually here, and she's doing some really great things. This is what I want to do for our listeners, Dr. Nance. I want you to do a little rewind. I want to understand when you recognized the problem that you have come to solve and what that problem is and how this all came together, this very cool messaging you've been focused on.
Well, it was a very specific event. I ended up solving a woman's 10-year medical mystery in 3 seconds. But it wasn't in my office. It was over TikTok. And after I ended up solving this woman's mystery, which was something called a glomus tumor, I thought, why did it take this woman 10 years to get an answer that I knew in 3 seconds? And what she didn't know is that if you go onto PubMed and type in glomus tumor, my name comes up, or my maiden name, Erin McDermott, because I'm one of the world's experts on glomus tumors. But she didn't know that when she just DM'd me kind of out of the blue. And so that kind of got me to thinking, well, number one, that there is a benefit to using social media for health information. But what the challenge is getting the right information to the right person at the right time.
Mm-hmm. So that obviously kicked off this impetus, but I want to dig a little more into this because I think there's almost like too much information, I guess, out there, and understanding how to absorb it. I joke about it all the time that, you know, if I came up with some weird rash or something on my skin, before you know it, if you read enough things online, you probably would come up with the fact that I should be putting myself in an ER immediately. This is an incredible coincidence of whatnot that you connected to this person and helped their problem. But, you know, knowing who to trust is probably the biggest problem we have in life, not just in medical issues, is figuring out that trust piece. You created that this is a problem and you want to get them the right place, the right time, and the right moment. How are you helping to build this? And maybe even explain a little bit to our listeners and viewers. We'll put all the links on what you've been doing to grow this community, but also to drive people to this new information that you created.
So I believe that healthcare does not start in your doctor's office. Healthcare starts on your phone, right? Because when you got that rash, it was 2 a.m. on a Tuesday. And you're not going to be able to, at the best, speak to someone about it maybe until the next day. But that doesn't mean that you're on your phone, you're on TikTok, you're on Facebook, you're on WebMD, you're asking ChatGPT. And the problem is that you just don't know who is the source of that information. And unfortunately, on the platforms that already exist, we know it's been studied. The misinformation spreads 6 times faster than accurate, credible information on the current social media platforms as they are, which is just a massive problem because then that really chips at the public confidence in the healthcare system. So what I designed was really the home base for medical experts to create credible, simple, easy to understand education for the public.
We're going to talk about FeelBetr, which I always love when vowels get dropped out, or consonants as well put in there. So walk me through this. I go on to FeelBetr. What's my experience like? If I have a question or an issue or a problem, tell me how I interact with this app.
The first thing you're going to do is you're going to input your symptoms, your diagnoses, and your health interests, because that is what is going to set the content that you are about to see. The whole point of FeelBetr is to customize and curate the content based on your health needs, right? So what that is doing on our back end, we built an algorithm of over 2,200 diseases and 100,000 symptoms that we have linked on the back end. Because, for example, that woman I told you, the glomus tumor, I knew that she had a glomus tumor in 3 words. She said that she had severe fingernail pain. Okay. There are many different things that could cause severe fingernail pain, but on our back end, you would be shown content about a glomus tumor because we know glomus tumor presents as severe fingernail pain. So the whole goal of the platform is not necessarily to diagnose you or have you self-diagnose your problems, but it's to help you recognize the patterns of symptoms that could be related to a certain condition and then empower you to have a better conversation with your doctor.
Okay, I love that. Now, because I was going to go down this avenue, I think I just came from an event, the one where we almost crossed paths, where I was literally like a neighborhood away from you, which was figuring out ways not to treat the illnesses, but figure out the cures, right? I know that you have a hypocritical challenge going on here, not a hypocritical oath, but we have the challenge is this, is that if I were to go search on a certain condition, whatever it would be, odds are online, I probably would come across 6 different pharmacy companies trying to push me a drug or a product, whatever, that's trying to treat a situation that might not be right. And you're trying to give the answers. First of all, do people have to pay for this subscription, or is this a free community? Tell me what this community is about for when they become a member of FeelBetr.
No. So FeelBetr is an absolutely free app to use for the public. How FeelBetr works is we have individual physician creators who are already absolutely wonderful creators on TikTok and Instagram and Facebook. They know how to create engaging content in a way that is easy to understand. But we are also supporting the physicians as part of large hospitals and large hospital systems. And what our goal is that when you go see your doctor, right, that appointment may be 5 minutes. You only have 5 minutes to tell your story, to have the doctor examine you, to have them tell you what's wrong with you, to give you the plan. That's just not enough time to get all the information across. So what we're really aiming for is for that doctor to have already created this library of information that they're telling their patients every day over and over again, but it's a way for the patient to access it on their own time, watch it again, and again, just become more confident in that medical education.
So I'm going to get to content a little bit later in our conversation here, but I want to talk about what you've seen so far. It's early yet, but talk about, I guess, maybe the benefits you've already seen in FeelBetr coming out into the open and who it's helping.
Well, number one, listen, we are in a very health political time. I cannot think of a time when people are questioning where to go to get credible health information. Right? For the longest time, it was you go to your own doctor, you go to the CDC website, you may look at the WHO, but there has been this unfortunate hit to the confidence and the trust in all of these institutions. In fact, trust in doctors has never been, it's at an all-time low. And there are many factors that cause this. One is time. But we really want to, as I said, become that home base for the physicians who they're not even treating you, right? We are doing this to reestablish trust in healthcare and science.
Love it. content creation, aside from a very excellent book you've created, for those who are looking at the screen right now going, who is this person? And is more familiar with her on TikTok. She's usually wrapped up in what I believe, University of Virginia. I'm guessing it's a Cavalier sweatband. Yes. I was doing my color scans beforehand. Feel like you're in the operating room, if you would, or you're seeing them in her scrubs. Talk about creating content, because I have this story, and you have the perfect example of how you've helped somebody. But I believe that all content creators are giving gifts to the universe by creating content that people could absorb. But there's this happy accident that happens, Dr. Nance. And that accident is that by creating this content, a gift comes back to you in return. What has been the gift to Dr. Erin Nance from creating such amazing content every single day, week, whatever it might be in the frequency you have these few years?
For me, honestly, it is just, I have never been thanked more in my life. I would say I get 100 thank yous on videos that I have posted. I have close to 1,000 videos that I have posted now over the past 3 years. Just that gratitude. And being a doctor today is hard. We're under a lot of pressure from our employers, from the insurance companies, from the patients, and every day is not a great, easy day. And so when I go on and I make content, I can see in real time that I'm having a genuine impact. And not only am I having an impact with the 15 patients that I saw in my office today, I'm having impact at a scale I never thought was even possible. So for me, people are like, well, why do you do it? Why do you spend all this time? Like, it feels amazing. It feels amazing to have so many people be so thankful and so grateful. And I really see this more in line with the original calling to be a doctor, right? We went into medicine to help people. And sometimes it just doesn't feel like that, right? When I'm on the phone for 45 minutes with an insurance company doing a peer-to-peer, trying to get a surgery approved for someone I know needs this surgery, all right, that knocks away at our, even interest in continuing to do this. So I find being on social media, honestly, just a huge confidence boost, it takes me back to why I wanted to help people in the first place.
Yeah, I was gonna say that, has it enhanced or challenged? Like, I imagine there wasn't, when you came out of med school and your residency and do all the expertise and all the certifications you have, I have the feeling that this was never what you ever imagined your world would be. And I want to ask the question: could you imagine it today without it?
That's a great question. When I graduated, I thought I would be, employed by a large, hospital system and work in the city, where I grew up. And, the last chapter of my book, I won't necessarily spoil it for people, but it is not a fairy tale ending. And that is really hard for someone who is a high achiever, who was taught if you work hard and you do everything right and you play by the rules, you will be rewarded. And it's just not the case. So I think I learned very early on that it's okay to have pivots in your life. And partly why I joined social media was I stopped seeing patients full time and went to part time because I had long COVID. I wasn't able to see that many patients. And I thought it was just a shame that only 20 people a week got the benefit of the years of knowledge. Like I am a technical ninja, right? I studied at the world's best orthopedic institute. I am very good at what I do. And I just thought more people should benefit from all of this expertise that I have.
Let's do the admin part of the show, because I want to have an extended version of Fun Street here. Dr. Erin Nance, please share where everybody can find you, all the things you want to plug, your books, your websites, everything. We'll put it in the notes. It gets more engaging when they hear from you.
Well, probably the best place you can find me is at Little Misdiagnosed on TikTok. That is my main social media platform. If people like to listen to podcasts or listening in the car, I am the co-host of a podcast called The Medical Detectives. It's kind of like Dateline meets Grey's Anatomy. So people love listening to that podcast. I'll show you right here. This is my book, Little Misdiagnosed. It came out with HarperCollins in June. You can get it at any Barnes & Noble, off of Amazon. And then what I'd really, I mean, this is my real purpose for being on this platform, but I'm here recruiting all your listeners to be some of my first users of the FeelBetr platform. And that is, it's technically live on the App Store. It's all one word, FeelBetr, BETR.
Awesome. We will put more plugs here. We'll also do a special promo across TikTok and Instagram that will make sure that we get everyone's message on this and where they can go sign it up. So excited to help you with that. Dr. Erin Nance, are you ready to go down Fun Street?
Let's do it. What other street would I want to be on?
Exactly. All right, so let's ease on to this little road here, and let's start off with this. Does Dr. Erin Nance have an all-time favorite movie?
Ooh. You know what? Because I'm watching a lot of movies with my kid now, I would say like I could watch Mighty Ducks, like original Mighty Ducks, anytime. Yeah.
Mighty Ducks is awesome. Actually, the original.
It holds. Okay. There are some movies that don't hold. This movie holds.
It does good. It was a chance to improve Emilio Estevez's image, I think, was what it was. All right, here we go. So the way we work here on Fun Street, we love to call this the Speakeasy Pub Crawl. Speakeasy is our way of being around here to connect with every conversation, and we're going to connect right here. Here we go. Of late, a song that you love to listen to or one that pumps you up?
I really love Party for You by Charlie XCX, which is not a pump-up song, but like you really want that like cry.
Favorite food that is not a dessert?
We make pasta at our house, and so it's called the 5P pasta. See if I can remember it. It is peas, Parmesan, pancetta, pasta, and we'll think of the rest, but you can imagine it's delicious.
I like it. Okay. A favorite dessert?
I love, there's a restaurant in New York called St. Ambrose. They have a raspberry sorbet, which I always eat in a cone. I don't understand, if you had the choice between a cone and a cup, why you would not also get something that was also delicious to eat. So raspberry sorbet in a cone.
I'm with you on that in ice cream. Every time I see somebody with a cup, unless you could eat the cup.
Wasted opportunity. The wasted opportunity.
You're missing out on the crunch, and the most important part here. An activity you wish you did more of?
Tennis. I can't get enough of it. I play it a lot, but it really brings me the most joy, not only as like a physical activity, but also as a social activity. And this is something I get this question asked a lot about. How do you do like all the things that you do, and you have all of these, all these, businesses going on? And I say that my 6 p.m. tennis group with my friends is just as important as any 10 a.m. business meeting I have earlier in the day.
I hear you. I like the balance. It's very important. And
plus, we drink rosé afterwards.
I mean, it's tennis and rosé. What a combination. An activity you wish you did less of?
Watch TikTok.
Which is challenging because you're on it. A new activity. One that you've recently tried that you like so much you want to tell all the listeners and viewers to try.
I am not the chef in my house. My husband is. So this is going to be more about along the lines of what he does. But we make our own butter. And once you start making your own butter, you can, yes, you could do it like old school 17th century style. Or you can use the kitchen mix, the KitchenAid mixer, like the big stand mixer. And I am not trying to say that I am the baker in the house. I probably haven't cooked in years, but making your own butter, I 100% approve.
I'll get to my final question in a minute, but I want to ask this one. Obviously, you have created thousands of pieces of content, specifically over the last 3 years. Most number of takes that maybe you had to redo one that you just either couldn't get it out, or it was early on, a certain flow? Most number of takes, at least to your recollection, that a certain piece of content took for you to create?
Well, a secret of mine to making content is I film one sentence at a time. So that's how I do my content. I do one sentence at a time, and I may repeat that sentence 10 times before I like that sentence. But I think all time is probably the first video I ever made, which is on YouTube. I still love this video. It was about, I calculated the hospital bill for the operation guy. So I came up with all of the costs for each of the surgeries that, you're taking the butterflies out of the stomach and you're taking the wishbone out. But that video, and of course, because it's my first video, when you look back at it, it's so cringy, right? You are not a true content creator if you are not cringing at the content that you made, not even, 3 years ago, but even like a month ago. So that took well over 3 hours and probably like hundreds of individual takes.
I'm going to shout out to someone who's been on the show, Nick Pollard, who is known as the People Displeaser. And Nick has walked around the cities of LA and Denver, where he walks and talks and tells his ideas. And he's a recovering alcoholic, and he's all about changing the way you should think about your life. A great coach, great speaker. And I was recently, as we discussed, I was in an area where you were, and I was walking on the beach. And I was filming a tremendous amount of content, and I just kept walking in one particular direction. The problem I ran into, I had walked and done so many retakes that I was 3 miles from where I was supposed to be walking barefoot, and now I had to walk back. And I'm like, holy moly. I go, this is not easy to do. So I give kudos to anybody who's creating content there.
Yeah,
So-
and again, like there are so many different styles of creating content. I happen to do these like self, and this is just like another tip to your audience for anyone who is thinking about how to start or where to start. And I worked with a social media company. I am not paid by them. They're called Hookpoint. They're absolutely incredible. They taught me the strategies for creating content online. But what was happening is I was just spending so much time on them so that I could follow the trends and, understand what are the best sounds and whatnot. And I told them, I don't want to follow the trends. I want to be the trend. And that would be my suggestion, is be the trend.
Yes. And don't walk barefoot on the beach 3 miles in one direction. The last question here is, if I could snap my fingers and Dr. Nance could be anywhere in the world, where would she be?
Hawaii, obviously.
Well, obviously. Everybody, please go check her out, Dr. Erin Nance. And you obviously can find her in all the different places we mentioned here on the show and the plug in the notes. She is, as on TikTok, most notably, as I'm trying to find it right in front of me so I can say it correctly here. One, a little misdiagnosed. And of course, check out FeelBetr, FeelBetr. And the website is feelbetr.health. And go check it out. Hey, thank you for what you're doing. Love your content. Keep doing what you're doing, because more and more people need to feel better and trust where they can learn how to do that. So thank you.
Thank you, Lou. It's been an absolute pleasure.
You got it. To all our listeners and viewers out there, thank you for joining us. Till next time, keep moving onward and upward. And remember, be brief, be bright, be gone.
You've been listening to Thrive Loud with your host, Lou Diamond. Check us out on the web at thriveloud.com and follow us on Instagram, LinkedIn, Twitter, and Facebook at Thrive Loud. And check us out on the Good Pods app at Thrive Loud, where you can follow, listen, and connect directly to Lou and all of the Thrive Loud episodes. Thanks for listening.